We're losing her. The scream echoed through the operating room as monitors blared and blood poured from the surgical incision. The lead surgeon's hands were shaking. Two residents stumbled backward in panic. A young nurse stood in the corner, never called by name during the entire procedure. But just when everything fell apart, she stepped forward, gripped the surgeon's hand, and said exactly 5 words: clamp, rotate, pressure, now, trust. No one said another word. Who was she? And why did people who dismissed her immediately follow her lead? Sophia Keller was 30 years old and worked as an instrument nurse in the surgical department at Timber Ridge Hospital. German-American with long brown hair, always pulled back in a tight bun, she had cold brown eyes and spoke in barely audible whispers. She was the definition of unremarkable. Always on time, always did her job correctly, never argued with doctors or challenged their decisions. Most of the surgical staff barely noticed her existence. She wasn't a charge nurse, didn't participate in medical rounds, and always positioned herself in the background during procedures. An instrument nurse can't possibly understand surgical technique, Dr. Richards, the chief of surgery, had said during a staff meeting. Their job is to hand us tools, not think about medical procedures. His sentiment was echoed throughout the department. She's quick with her hands, but that doesn't mean she understands medicine, commented Dr. Sarah Chen, a senior resident. Let's not confuse efficiency with expertise. Another surgeon, Dr. Martinez, was even more blunt. Don't let nurses start giving orders in my OR, okay? There's a hierarchy here for a reason. Sophia never responded to these comments. She simply continued her work, maintaining surgical instruments with meticulous care and anticipating the needs of surgical teams before they even realized what they needed. But there were moments, brief glimpses, when her knowledge seemed to exceed what anyone expected from an instrument nurse. During a hip replacement surgery one morning, Sophia handed Dr. Richards a rare type of hemostatic clamp that he hadn't requested. It was an unusual choice, not typically used for that type of procedure. Dr. Richards looked at her questioningly. "Why are you giving me this?" 10 seconds later, the patient began bleeding faster than anticipated, and that specific clamp became the exact tool needed to control the hemorrhage and save the surgery. But Sophia didn't take credit for her foresight. She simply stepped back into the shadows as if nothing had happened, continuing to organize instruments, while the surgical team praised Dr. Richards for his quick thinking. This pattern repeated itself throughout her time at Timber Ridge. She would quietly provide exactly the right tool at exactly the right moment, make subtle suggestions that prove crucial, or position equipment in ways that seemed to anticipate complications before they occurred. Yet nobody really noticed, or if they did notice, they attributed her actions to luck rather than knowledge. During lunch breaks, while other nurses discussed their cases and shared experiences, Sophia ate alone, reviewing medical journals that seemed far too advanced for someone in her position. When newer nurses asked her questions about surgical procedures, she would answer with surprising depth and accuracy, but always quietly, always without drawing attention to herself. "You know a lot for an instrument nurse," commented Jessica, a recent graduate who'd started working in the department. Sophia just smiled. "You pick things up after a while." But Jessica sensed there was more to Sophia's knowledge than casual observation could explain. The way she anticipated surgical needs, the precision with which she handled instruments, the calm confidence she maintained even during the most chaotic procedures. It all suggested experience that went far beyond what her official role required. The other staff members saw Sophia as competent but unremarkable, a reliable background presence who kept the surgical department running smoothly without ever stepping into the spotlight. They had no idea that their quiet, unassuming colleague carried knowledge that would soon prove more valuable than any of their medical degrees. In her personal locker, she had taped only one handwritten piece of paper. No need for credit, just need patients to open their eyes after surgery. A special case arrived at Timber Ridge Hospital on a Tuesday evening. A young pregnant woman with an ectopic pregnancy, weak pulse, and rapid blood loss risk that could turn fatal within minutes. The surgical team assembled quickly. Dr. Richards as lead surgeon, 2 residents, and an anesthesiologist. Sophia was assigned her usual role, instrument nurse, responsible only for handing tools to the doctors. Dr. Richards made his position clear before they began. Nurse Keller, you don't need to participate in any technical decisions. Just provide instruments when requested. Dr. Amanda Foster, the senior resident, nodded in agreement. We've got the medical side covered. Stick to what you know. The surgery began with standard protocols, but within 20 minutes, complications arose faster than anyone had anticipated. The blood pooling was more extensive than the ultrasound had revealed, and the patient's blood pressure began dropping rapidly. Dr. Foster, who was supposed to be assisting, began to panic as she struggled with the delicate work of separating damaged tissue. Her hands shook as she tried to locate the source of the bleeding. I can't get a clear view, she said, her voice rising with stress. There's too much blood. Dr. Richards tried to maintain control, but Sophia could see his technique becoming erratic as the pressure mounted. He was using broad, aggressive movements when the situation called for precision and finesse. Sophia stepped closer to the table, observing the surgical field with experienced eyes. Doctor, she said quietly, you might consider using an R-turn suture pattern to redirect the blood flow away from the damaged area. Dr. Richards didn't even look up. Nurse Keller, focus on your job. We don't need surgical advice from instrument staff. Dr. Foster shot Sophia a withering look. Do you want to get fired? Stay in your lane. But Sophia could see what the doctors couldn't or wouldn't acknowledge. The bleeding pattern indicated a specific type of vascular damage that required a completely different approach than what they were attempting. She tried once more. The hemorrhaging suggests arterial involvement. If you approach from the lateral aspect and create a controlled pressure gradient, that's enough, Dr. Richards snapped. One more interruption and you're out of this, or permanently. Sophia stepped back, but she didn't stop observing. She watched as Dr. Foster's attempts to control the bleeding became increasingly desperate. The monitors showed the patient's vital signs declining steadily. 2 minutes later, the situation reached a crisis point. The surgical incision suddenly opened wider as damaged tissue gave way under pressure. Blood began flowing faster than the suction could remove it, obscuring the entire surgical field. Her pressure's dropping fast, called the anesthesiologist. Doctor, Foster's hands were now visibly shaking. I can't see anything. There's too much bleeding. Dr. Richards tried to take over, but his movements were too aggressive for the delicate repair work needed. Instead of improving the situation, he was making it worse. That's when someone screamed, "We're losing her!" The monitors began blaring as the patient's heart rate became erratic. The surgical field was a sea of red, and both doctors were frozen in panic, unsure how to proceed. Sophia looked at the chaos around her. Experienced surgeons reduced to helpless confusion, a young woman's life hanging in the balance, and medical knowledge being abandoned in favor of ego and hierarchy. She made a decision that would change everything. Without asking permission, Sophia stepped directly to the operating table. She placed her hands firmly over Dr. Richards' hands, guiding them to the correct position with steady confidence. Her voice cut through the panic with absolute clarity and authority. Clamp, rotate, pressure. Now, trust. The entire operating room fell silent. For 8 crucial seconds, everyone followed her instructions exactly. Dr. Richards, guided by Sophia's hands, applied the clamp at the precise angle she indicated. Dr. Foster rotated the retractor to create the visibility Sophia knew they needed. The surgical technician applied pressure exactly where Sophia directed. Within moments, the bleeding was controlled. The patient's heart rate stabilized. The crisis was over. As the immediate danger passed, the OR remained unusually quiet. Everyone had witnessed something that didn't fit their understanding of hospital hierarchy or medical expertise. Dr. Foster was the first to break the silence, her voice barely above a whisper. How did you know exactly what to do? Sophia didn't answer immediately. She helped complete the procedure, ensuring every step was executed with the precision the patient deserved. Only after the woman was stable and being prepared for recovery did Sophia finally respond. "I learned those techniques in a field hospital," she said quietly. 15 years ago." Dr. Richard stared at her. "Field hospital? What field hospital?" "One where we didn't have monitors to tell us when someone was dying," Sophia replied. "We had to learn to see it with our own eyes and fix it with our own hands." After the surgery, as the team was cleaning up, Dr. Foster approached Sophia in the recovery area. "Where exactly did you learn those techniques?" she asked. "That wasn't standard surgical protocol." Sophia looked at her for a long moment, then said simply, "I learned in a medical tent 15 years ago, when staying calm was the only thing that kept people alive." In her uniform pocket, she always kept a faded piece of fabric used for wrapping surgical instruments. Embroidered on it by hand were the words, "Field 731, Mosul 2009. An older doctor who had been reviewing surgical reports from that evening recognized something in the documentation that caught his attention. Dr. Michael Harrison had served as a military surgeon in Iraq, and the techniques described in Sophia's case report sounded familiar. He found Sophia during her lunch break the next day, sitting alone in the hospital cafeteria. "Your name is Sophia Keller?" he asked, taking a seat across from her. "Did you ever serve under the call sign Ghost 9? Sophia looked up from her sandwich, her expression carefully neutral. "Why do you ask?" Dr. Harrison pulled out an old photograph from his wallet, creased and faded from years of carrying. It showed a young woman with short hair, her hands deep inside a patient's chest cavity, manually compressing a heart during what was clearly a field surgery operation. "This was taken in Mosul, 2009, he said quietly, "during the bombing of the civilian market. You were the one who kept hearts beating when we didn't have electricity for the monitors." Sophia studied the photograph, her face softening with recognition and pain. "I was the person who kept hearts beating when there were no machines to do it for us," she confirmed. Dr. Harrison nodded slowly. "I thought I recognized those techniques. You were with the International Red Cross, weren't you? A medical student volunteer." Sophia's story began to unfold. In 2009, she had been a medical student volunteer with the International Red Cross when a devastating bomb attack hit a crowded marketplace in Mosul. The primary medical facility was destroyed, leaving only a small field hospital to handle dozens of critically injured civilians and soldiers. "After the bombing, I was the only person left standing at the aid station who had any medical training," Sophia explained. "The senior medical staff had been evacuated with the most critical cases, and I was alone with patients who were dying." For 16 hours straight, Sophia had performed emergency surgeries that were far beyond her official training level. She had no choice. It was either learn immediately or watch people die. "I did things that medical students aren't supposed to do," she continued. "I made decisions that should have been made by experienced surgeons, but there was no one else." Dr. Harrison remembered that day clearly. "You saved 14 lives during that attack. 14 people who would have died if you hadn't been there." After the crisis, Sophia had been recommended for a commendation from the Red Cross, but she had declined and returned to the United States immediately. "I didn't want to live off that experience," she said. "I wanted to know if those skills could still save lives 15 years later in a regular hospital without the adrenaline of a war zone." Dr. Harrison was quiet for a moment, processing her story. "So you deliberately took a position as an instrument nurse, even though you're capable of much more?" "I wanted to learn how American medicine worked from the ground up," Sophia replied. "I wanted to understand the system before trying to work within it, and I wanted to see if the techniques I learned under fire would translate to civilian surgery." Word of Sophia's background began to spread quietly through the hospital. Dr. Richards, who had been so dismissive of her suggestions, found himself reviewing the surgical report from that emergency procedure with new eyes. The techniques Sophia had guided them through weren't just effective, they were innovative approaches that he'd never encountered in his medical training. Dr. Foster approached Sophia directly. "I owe you an apology, and probably more than that. I owe you my career. If that patient had died because I was too proud to listen to you, you don't owe me anything, Sophia replied. You did the work. I just helped you see what you already knew how to do. But Dr. Foster shook her head. No, that's not true. You didn't just assist. You led. You took command of a situation that was spiraling out of control, and you saved that woman's life. The hospital's chief of staff, Dr. Elizabeth Moore, requested a meeting with Sophia after reviewing the incident reports. I've been reading about what happened in that emergency surgery, Dr. Moore said, and I've been asking questions about your background. I think we need to have a serious conversation about your role here. Sophia tensed, expecting to be reprimanded for overstepping her boundaries. Instead, Dr. Moore surprised her. I want to offer you a position as a clinical instructor for our nursing staff. Your experience and knowledge are being wasted in an instrument role. Sophia was quiet for a long moment. I appreciate the offer, but I'm not looking for recognition or advancement. This isn't about recognition, Dr. Moore replied. This is about using your skills where they can do the most good. You have knowledge that could save lives and train the next generation of medical professionals. Dr. Harrison, who had been instrumental in bringing Sophia's background to light, added his support. You spent 15 years hiding your abilities, but hiding them doesn't honor the people you saved in Mosul. It wastes the lessons their suffering taught you. Sophia considered their words carefully. She thought about the young nurses who asked her questions during breaks, hungry to learn but lacking guidance. She thought about the residents who panicked during emergencies because they'd never been taught to stay calm under pressure. If I were to accept, she said slowly, I wouldn't want it to be because of what I did in Iraq. I want it to be because of what I can do here now for these patients. Dr. Moore smiled. That's exactly why you're the right person for the job. The head of surgery, Dr. Richards, who had been notably absent from these discussions, finally approached Sophia privately. I was wrong, he said simply. About you, about your knowledge, about the value of your input. That emergency surgery, you didn't just help, you led, and you led better than I did. Sophia looked at him steadily. We all did what was necessary to save a life. That's what matters. No. Dr. Richards shook his head. What matters is that you knew what was necessary when the rest of us didn't. And you had the courage to act on that knowledge despite how we treated you. He paused, then added, I'd like to recommend you for inclusion in our surgical training program. Not as a nurse, but as an instructor teaching emergency procedures to residents and attending physicians. For the first time since arriving at Timber Ridge Hospital, Sophia smiled genuinely. I'll consider it, she said, but only if the focus remains on saving lives, not on my story. Type respect. If you believe real heroes don't need recognition, they just need the chance to do what's right. Sophia didn't accept the formal instructor position that Dr. Moore offered. Instead, she negotiated something different. Permission to conduct informal training sessions during break times, teaching practical emergency techniques to anyone who wanted to learn. Her first session was held in the hospital's break room during the evening shift change. Word had spread quietly among the nursing staff, and 12 people showed up, a mix of new nurses, experienced staff, and even a few residents who had heard about the Mosul techniques. I'm not here to teach you textbook medicine, Sophia began. I'm here to teach you what to do when the textbook isn't enough. She taught them how to read vital signs with their hands when monitors failed, how to assess blood loss by observing skin color and patient responsiveness. Most importantly, she taught them how to stay calm when everyone around them was panicking. In field conditions, you don't have time to consult protocols, she explained. You have to trust your training, your instincts, and your ability to think clearly under pressure. Jessica, the young nurse who had always sensed there was more to Sophia's knowledge, was among the most eager students. How do you stay so calm during emergencies? She asked. Sophia considered the question carefully. I learned that panic is contagious, but so is calm. If you can control your own fear, you can help others control theirs. And when everyone is thinking clearly, patients live. Within weeks, Sophia's informal training sessions became the most sought-after continuing education at Timber Ridge Hospital. Nurses who attended reported feeling more confident during emergencies. Residents began seeking her out for advice on handling high-pressure situations. But perhaps the most significant change was in the hospital's emergency response protocols. Dr. Moore authorized the implementation of Sophia's 5-word emergency command system: clamp, rotate, pressure, now, trust. It became the standard response for surgical emergencies throughout the hospital. Those 5 words create immediate focus and coordination, Dr. Foster explained to a group of new residents. They eliminate confusion and get everyone working together instantly. The protocol was so effective that other hospitals in the region began adopting it after hearing about Timber Ridge's improved emergency surgery outcomes. Sophia's influence extended beyond formal training. Young nurses began approaching her during their shifts, asking questions about technique, seeking advice on difficult cases, or simply looking for reassurance during challenging days. "You helped me understand that being a nurse isn't just about following orders," one new graduate told her. "It's about using your knowledge to advocate for patients, even when that's uncomfortable." Dr. Richards, who had once dismissed Sophia's input so harshly, became one of her strongest supporters. He began consulting with her on complex cases and publicly acknowledging her contributions during surgical debriefings. "I learned something important from Nurse Keller," he told his residents during a teaching round. "Medical knowledge isn't about hierarchy or titles. It's about using whatever you know to help patients, regardless of your official role." The pregnant woman whose life Sophia had saved during that emergency surgery returned to the hospital 6 months later with her healthy baby. She specifically asked to meet the nurse who had helped save her life. "The doctors told me what happened," she said, holding her infant daughter. "They said you were the one who kept me alive when things went wrong." Sophia looked at the baby, healthy, alert, perfect, and felt the same quiet satisfaction she'd experienced 15 years earlier in that field hospital in Mosul. "I just did what needed to be done," Sophia replied. But the young mother shook her head. "You did more than that. You made it possible for her to exist." Type "I will live kindly" if you believe someone doesn't need a title to change another person's entire journey. There are people who don't need awards or recognition, don't need titles, don't need microphones. They just need one moment and 5 words at exactly the right time. Sophia had never demanded a higher position, never fought for the spotlight, never competed for credit. But she, the person nobody listened to, became the one who saved lives when everything started falling apart. The truth about expertise isn't that it demands attention. It's that it works so quietly, so efficiently, that people mistake competence for luck until precision saves their lives. Sophia's story reminds us that the most crucial knowledge often belongs to the people standing in the background, watching, learning, preparing for the moment when their skills become essential. In a world where loud confidence is often mistaken for competence, Sophia proved that true professionals don't compete with others. They compete with the crisis until the crisis loses. Her 5 words, clamp, rotate, pressure, now, trust, became more than an emergency protocol. They became a philosophy of action. When chaos erupts, someone has to provide clear direction, immediate focus, and unshakable confidence. The young nurses who train under Sophia's guidance are learning more than medical techniques. They're learning that knowledge without action is worthless, but action without knowledge is dangerous. The combination of both, applied with calm precision, is what saves lives. She teaches them that being right isn't about being recognized. It's about being ready. And readiness, she explains, comes from understanding that every patient deserves your absolute best, regardless of whether anyone notices your effort. The residents who once dismissed her suggestions now seek her advice before difficult procedures. They've learned that wisdom doesn't always come with advanced degrees or impressive titles. Sometimes it comes from experience earned in the hardest possible circumstances. Dr. Richard still thinks about that emergency surgery, about how close they came to losing a patient because he was too proud to listen to someone he considered beneath his expertise level. It changed not just how he practices medicine, but how he teaches it. Medical knowledge belongs to everyone who can use it to help patients, he tells his students now. Hierarchy exists for organization, not for limiting who can contribute to saving lives. Sophia continues her work at Timber Ridge Hospital, still wearing scrubs, still preparing instruments, still standing ready for the next emergency. But now, when she speaks, people listen. Not because her title has changed, but because they've learned what she's always known. Skill speaks louder than position. In her locker, next to the handwritten note about patients opening their eyes after surgery, she's added a new piece of paper, a thank you card from the mother whose life she saved, with a photo of a healthy baby girl. It's the only recognition she needs.
If you believe in stories that touch the heart like this one, leave a comment. And don't forget to subscribe to LN Steel Heart Stories. We tell the stories that shouldn't be forgotten. Real people are creating and telling stories, not mass-produced AI.